Hello, this is Robert Capucci. I'd like to thank you for joining us for another PT on the Net video interview. Today what we're going to talk about is how foot mechanics can either alleviate or in some cases exacerbate low back pain. My guest today is podiatrist, group exercise instructor, and personal trainer, Dr. Emily Splichal. Hello, Dr. Emily.
How are you?
I'm doing all right. Thank you very much for asking. Dr. Emily, one of the most disheartening things we witness is a client comes into the gym and they're apprehensive but they're really excited, they get going towards their goal, they're doing great, they're not missing their workouts, and then they get injured. Instance of low back pain maybe most often, and they stop training, and it not only affects their training, it kills their spirit. They become very discouraged. How does the foot and the mechanics of the foot affect low back pain? Because what we normally hear is when somebody has low back pain, just train their core. That's kind of ambiguous. Is that the whole picture?
It's very much not. Again, with the prevalence of low back pain. So I always tell my classes that 60 to 80% of people experience low back pain at some point in their lives. And a lot of the causes of that low back pain is soft tissue. So we have a lot of these muscle imbalances, biomechanical imbalances. Unfortunately, a lot of trainers look right at the lower back. What muscles are attaching to the lower back, what's going on with the pelvis, but they're missing a large chunk of that, which is the feet. So again, as I had mentioned in other interviews, is that the foot is our foundation. Okay, so if I do not have strong posture in my feet, it has to affect me more proximally. So if I'm stretching my hip flexors, stretching my lats, strengthening my core, strengthening my glutes, but I'm never looking at the feet, I'm missing a large part of what could be a cause of my low back pain.
Just to stop you there, give us an example of what you would look for in the feet and what you would be able to do with that information.
Okay, so there's two different reasons for low back pain that relate to the feet. Okay, the first one is going to be bilateral, which means both of my feet are doing the same thing. They're both have improper posture. They're both kind of messed up.
Let's see that.
Okay, so both of my feet are again falling into this overpronated flat foot position, which is going to throw my knees inward. Okay, it's going to throw my hips forward. So now I have a lower cross syndrome anterior pelvic tilt position because of my feet.
When you say lower cross syndrome, what do you mean by that?
The lower cross syndrome is that anterior pelvic tilt, increased lordotic curvature, which can come from my feet. So if I'm focusing on my hips, stretching my hip flexors, tightening my glutes, engaging my core, but my feet are still flat bilaterally, I'm missing the initial cause, the initial initiating factor of my low back pain. So we have to look down at the feet. The second reason that people get low back pain related to the feet is if one foot, so just one of my feet, are now flat. Okay, so we have a unilateral imbalance in our feet, in our posture, in our foundation. That's going to affect my back differently. If one of my feet is now pronated, that means one of my legs, my right leg, is now shorter. That has to affect my hips and my lower back in the frontal plane. My hip is going to drop down. Okay, so our body compensates and then creates like a functional scoliosis to compensate so that I keep walking straight. That also puts a lot of stress on our SI joint or sacroiliac joint on one side. So again, if we look isolated in the pelvis, in the hips, and never look down to the feet, we're going to miss a large piece of what causes low back pain.